something that's different at the practice, and it's more has to do with the philosophy.
Here's Dr. Jan Mensink with answers to your common medical questions.
Today I just thought that we'd mention something about nosebleeds. I just saw a patient that has a nosebleed. The important thing to look at and differentiate when you have a nosebleed is it bleeding from the front or from the back. And there's several little tips that we recommend patients do. If you're swallowing a lot of blood, it's usually a posterior nosebleed. Those you need to get medical attention right away. The second issue, if it's from the front and you're bleeding from the front, what mostly happens is you have a little vessel in what's called Hasselbeck's triangle, the little area right in the middle of the septum in the nose. And it is very simple to stop. And here's what you do. You take your two fingers and you pinch where I'm pinching like this, not in the tip, but right here, as hard as you can for 10 minutes. So it hurts. That will stop most anterior nosebleeds. Now when you get a nosebleed, it can be due to lots of things. The patient I just saw with a nosebleed, he had a posterior nosebleed, ended up having packing put in, and it's very painful and all that kind of stuff. But here's the important thing. The first thing that you need to realize, this patient didn't understand this, he's taking a leave every day for a knee problem. You know that one Aleve tablet, one ibuprofen tablet, one naproxen tablet, one Motrin tablet, one baby aspirin can change the ability of the blood to clot for 5 days. So it just makes it easier to have a nosebleed. The second thing that's important, when you have a nosebleed, especially if there's no trauma involved, and if you're getting up above the age 50, especially if it's a posterior or back nosebleed, the issue is not the nosebleed. The issue is there's something wrong with the vessels. The vessels and the arteries in your body aren't as healthy as they should be. And as I told this patient, the issue that you had a bleeding here doesn't bother me. The vessels are in poor shape. But the vessels are in poor shape here, they're in poor shape here, here, everywhere. If you have a bleed inside here, it's, oh boy, it's terrible. You have a stroke. So once you have a back part of the nosebleed and you're a little bit up in age, over age 50, we recommend you look at all those risk factors that make your vessels not so strong. So the issue is not the nosebleed, but why it occurred. And that you need to see a doctor. You need to make sure your cholesterol's okay, your weight's okay, you're not a pre-diabetic, all these health things that we forget about. That's where the emphasis has to be placed.